The fuller your smile is, the less teeth you're missing, the less problems you have. It doesn't accentuate more problems. As people start to lose teeth, you lose the next tooth quicker. And when you lose that tooth, you lose the next tooth even quicker. Things exponentially start to snowball. So the sooner you can nip something in the butt, the better. You know, this is gonna sound mundane, but typical restorative dentistry, when you're talking about fillings and crowns, I almost feel like we could do them with our eyes closed. We won't, but we almost feel like we could do it with our eyes closed because it's something that's just so routine and so basic and so simple to do. But you've got to develop that baseline of healthy and getting teeth sound and structures. When it comes to replacing missing teeth that are already there or that you've created because the tooth was unrestorable, then you have to sit down with the patient one-on-one and again, make sure you're on the same page. All right, what are you looking for? Are you looking for something that's removable? Are you looking for something that's fixed and stuck in place? What are our options in those scenarios? With every option in life, there's pros and cons. As long as I understand, I always tell people, I don't care what you pick, okay? As long as you understand the pros and cons of each scenario. And for me, I always tell my patients that my biggest fear is I don't offer a selection to you that 2 years later you say, well, my neighbor Joe got this done. Wow, if I knew this was possible, I would have done this. So I go over, I don't care who the person is in the chair, never judge anybody. Everybody should know all of their possibilities of what we can do to fix that situation. We go through the pros and the cons, and again, I send them home and I say, now you need to think about it, and I put it on paper for them. So now you can take what we spoke of. I have everything listed out for you. And now you can go home and say, okay, well, all right, I remember I'm talking about this. This isn't for me. Well, this has my attention and this has my attention, and there's no way I'm doing this. But that way they get to think it over a week. And again, we fall back to if it's a good idea today, because a lot of people have an immediate reaction of, wow, I want that. Okay, great. Then you'll want it a week when you've thought it through. So we always make people go home and think through the possibilities of the way to put their mouth back together.